Good afternoon, everyone, and sorry for our technical difficulties, but we have made some accommodations and hopefully you're able to join us and revisit our conversation with up-to-date news on COVID-19 and how it impacts Montgomery County. Again, I'm Travis Gayles. I'm the County Health Officer and Chief of Public Health Services, and we're taking this opportunity this afternoon to address questions that you have as well as provide updates to where we stand. At the moment, there are 107 residents across the state of Maryland who have received positive diagnoses for COVID-19. 33 of those residents reside in Montgomery County. Overnight, we received the news of our first COVID-19 related fatality, which was a Prince George's County resident. And we also received news of the first diagnosis in a child, a 5-year-old who lives in Howard County. I want to emphasize that as of date, we have not received any positive results for anyone under the age of 18 within our jurisdiction, and we continue to follow the trends and take the necessary steps in order to find out as much information as we can to inform the public. Also want to highlight a couple of other areas before we take questions. One is the notion of testing availability and who gets a test. So I also want to make clear to everyone at home that no one, and we are not at the point where we are offering testing for the general public. Tests have been reserved for individuals who have significant clinical histories and presentations that are concerning for COVID-19 based upon their interactions with their healthcare provider. Healthcare providers do have the option of ordering the test directly through private labs that don't require any level of approval from the state or local health department. Also want to emphasize that before weeks ago, and up as recently as to a couple of weeks ago, testing criteria was related to travel history. We know that we have seen evidence of community transmission, not only in our own state, but across the country, and that has necessitated us to ask other questions outside of one's travel history. To that end, I want to also emphasize that practitioners have been asking such questions, particularly related to those individuals who have clinical symptoms such as fever, shortness of breath, and or cough that may not be explained by other diagnoses such as influenza, allergies, asthma, so on and so forth. So individuals who've needed those tests have hopefully been getting those tests, but I want to make sure that we also let you know that we are doing everything in our control to be able to explore other alternative options to increase access to tests for individuals who may not have a healthcare provider or may have clinical symptoms but haven't been able to get tests so far. Also want to emphasize one other thing, is that in the midst of anxiety right now, because numbers are increasing, daily reports are showing numbers increasing significantly, I wanted to comment on why that is the case. So first and foremost, one of the reasons why the numbers are increasing is because more individuals are getting tested, and we're not reliant solely on the test allocation from the Centers for Disease Control. The second component is, as we get more positive results and get a better understanding of the burden of the disease within our communities and how it's transmitted, we'll also have a deeper understanding of potential transmission pockets and other areas and trends that are relevant to putting in strategies that will cut down on the risk of transmission and hopefully cut down on new cases in the future. Some of those actions have been input in the last several days over the course of the last week, including emphasizing social distancing, closing restaurants, closing schools, closing bars, closing gyms. All of those things are being done in an effort to, again, encourage social distancing and cut down on the number and types of exposures we have with others to cut down on transmission. So those are our global updates. I'd be happy to take questions. I know that we did ask for folks to write and send in questions during our technical blip there. So we'll do our best to try to answer as many questions as possible during the time allotted. Again, thank you for your time and thank you for your patience. Oops, sorry. So we're also improvising a little bit and using old school method here. So the first question is that the governor said groups of 10 or less. Will we allow local businesses to continue to function with those guidelines? So let me be clear. The governor's directives have been very clear in terms of encouraging large gatherings over 10 to not happen. And in fact, talk today about putting in actions to ensure that that doesn't happen. We recognize that in certain settings, such as grocery stores and businesses, that there may be the possibility of larger numbers of folks being in those spaces. We'll continue to monitor that because we also have to think about the types of businesses that we keep open that are essential to our daily lives and provide us with the resources we need to function. And so even in those settings where there might be crowds larger than 10, we're strongly encouraging social distancing in those places and creating policies that may space things out so that we're not in violation of the 10-person rule. But again, we'll continue to monitor those situations and come up with policies accordingly. Next question. So there's a question about hotels. What is being done for and about hotels? Well, again, consistent with the review of retail businesses, we're continuing to look at those different areas and venues that may be impacted by space requirements and capacity restrictions. Again, we're emphasizing in all instances, whether we're talking to businesses or talking to individuals, to emphasize the policies of social distancing and making sure that in larger spaces we don't see congregation of groups over size of 10. And to that end, we have had lots of events canceled in settings such as hotels to prevent, again, the potential risk of transmission in those larger groups. All right. Next question. What is driving the increase of cases in recent weeks? So this gets back to the point I raised a little bit ago. If you think back to some of the early conversations we had in some of our press conferences and where we mentioned that as we test more people, we're likely to see more cases. Not only are we seeing more cases, again, we're seeing evidence that there may be methods and mechanisms of transmission that aren't tied to travel. So we've got travel history, we've got contacts to travels, as well as potential for community transmission. So I think there are two factors that are driving the increased number of diagnoses. One is simply more tests are being ordered and more people are getting tested and screened. And the second component is, obviously, as more cases pop up, we have to be mindful of the potential of increased transmission from person to person. This underscores those strategies of social distancing to cut down on those opportunities and exposures we have as groups, as well as individuals coming into contact with each other to cut down on the transmission rates within our communities. The next question, what is the scale of community spread in the county? This is an excellent question because we've talked about the differences in transmission. And again, if you think back to our initial conversations, we talked about the factors that would drive us to change our response. So the first one we said, are we seeing an increase in suspicious cases? Are we seeing an increase in actual cases? And then within that, what the cases we're seeing are the methods of transmission changing. So are they travel related or community transmitted? And then the last component that we talked about was if we were seeing any change in the disease pattern, particularly the severity of illness. Well, we've not seen any significant departure from the clinical pictures that have been experienced overseas, as well as the cases here in the United States. We have seen an increase in the number of cases, and we are seeing some components that are suggestive of community transmission. Based upon the information that we have so far, we don't have definitive information to confirm community transmission within Montgomery County, but there was a case of community transmission in Prince George's, which suggests that that is a potential in our community. And because of that, one that we continue to expand our testing criteria beyond just travel, and to also continue to preach the notion of social distancing and restricting our activities and exposures due to that increased risk. The next question, if I have an underlying medical condition, can I recover from this? So to whomever wrote this question, I want to make sure that you understand that all of the different policies we're putting into place, such as social distancing and protecting vulnerable populations, have been put into place to make sure that you stay safe and cut down on your risk of transmission and exposure. So to your question, will you recover? The overwhelming majority of folks with cases have responded favorably. We do know that based upon the data, those who do have underlying medical conditions may complicate your clinical picture to some degree. The degree to that, which within that happens, we don't know for sure. We just know that it may predispose you to having a more severe disease course. That does not mean that you are destined to a particular outcome, and it does not mean that you won't recover. The expectation is if you have, seek medical treatment and hopefully can have a more mild to moderate course of disease, that you should expect to have a full recovery. The reality is we don't know fully because this is a new virus, but based upon the information we have is individuals who do recover from this most likely will recover back to their normal state of health. At this point, we just simply don't know the long-term effects. This is a great question, and one that I'm sure many of you at home are wondering about because I'm sure you're tired of eating your home cooking. The question is, what precautions should people use when ordering takeout and delivery? Well, we don't expect, based upon the information we have so far, that there's any risk of exposure past in terms of food service and food preparation. And there's no suggestion that there's any disease transmission in terms of food items themselves. What we're recommending to folks is when they're delivered, again, to minimize your interactions with delivery folks and minimize your exposure. So potentially having the food delivered on your doorstep or your front door and picking it up. And again, making sure to continue to wash your hands and wash surfaces that we would tell you to do anyway. And we've been preaching from the very beginning. So there isn't any expectation that there's any increased risk from getting takeout or delivery food items. In fact, it may spice your life up since you're trying to break out of the cabin fever from quarantining or just staying indoors more regularly. The next question, what is the status of Montgomery County patients? So as best as we know right now, of the 33 cases that we have, all of them, as best as we know, are clinically stable. It's important to note that the first 3 cases that we had in our county were also the first 3 residents who tested positive for COVID-19 in the state of Maryland. Those individuals have cleared and have been released back to their normal state of being and their normal lives. But based upon the information that I have right now, the patients we have are stable. I do think that there may be a handful hospitalized. I'm not sure because we're getting more cases on a daily basis and getting more information, and that necessitates doing a deeper dive and asking more facts about those cases. When and where is drive-up testing coming to Montgomery County? So before I answer that, I want to take a step back and level set and give you some information on the concept of drive-up testing. So first and foremost, drive-up testing in other jurisdictions has been, again, specifically for individuals who have been screened by a provider and deemed to warrant or suggestive of getting a test based upon their clinical presentation and the absence of another diagnosis that could explain their clinical picture. And in those instances, they have required a prior authorization or some type of doctor's note requesting a test. We have been working to set something up in Montgomery County over the last week and a half. I can personally attest to you, I have spent a significant amount of time on the phone trying to line things up. We're not ready to make an announcement of that, but stay tuned. Hopefully that will come in the very near future. A large driver of this is based upon testing ability and capacity. Again, even in the setting of having increased tests through the private laboratories, they still have constraints on their supply as well. So we're working hard. Again, lots of details are in place. Again, waiting to get the final notes in terms of the capacity so that we can be able to offer a meaningful experience to our residents and be able to offer it to as many people as possible. This question is, can nail salons stay open and hairdressers and stylists too? So this is an excellent question that we continue to think about. Because as we think about the type and quality of interactions and exposures people have, we're mindful of those types of things. At the moment, we're strongly emphasizing social distancing principles and other good hygiene practices, recommending that individuals, whether they're employers or employees, who are exhibiting any types of symptoms, stay home, avoid those appointments, as well as, again, minimizing the exposure folks have in those spaces. So spreading clients out and increasing distance between clients, as well as being mindful about making sure to follow, proper precautions when interacting from the service provider and the client at hand. I'm not sure I understand this one exactly. Is the state ordering vehicle emissions testing stopped? Not sure I understand this, so we'll put a hold on it. And yeah, this is a repeat for precautions for food, which we've addressed. We've addressed this one already. We've addressed this one already. Addressed this one already. This question comes up, should college students be quarantined? Quarantine is something that is reserved for individuals who we think have a high-risk exposure and have been identified as coming into contact with known cases or someone of a suspicious case. So in rare instances would we recommend quarantining a large group of individuals without specific criteria and specific knowledge related to their background and related to their potential history of exposures. So in this case, we're not offering or recommending a blanket quarantine for individuals who may have had a contact history that is suggestive of that. The health department would notify them, or their provider would notify them to take those necessary actions. Okay. So that was the last question that we had. I hope we answered all of your questions. Again, our goal is to try to be as forward-facing and providing you with up-to-date information so that you see us as a reliable source of evidence-based, fact-based information, recognizing that there's a lot of uncertainty at this time. So we want to make sure that all of our residents of Montgomery County have the most up-to-date information, up-to-date guidelines, and know that we're working hard to keep you safe. Thank you.